Now, I think there were with one or two of you in my previous session. You were, okay. What I'm going to do then is go to other examples because I used a couple of examples this morning and another half dozen available. So I am going to go to some of those others, if that's okay. All right, let me, I'll move forward for just a minute and then come back to some of these. Okay, one more. Okay, an older white male calls by phone to explore the possibility of entering psychotherapy with you. He asks an extensive number of questions about your background, your training, years of experience and approach to treatment. He wants to know who you share an office with, how confidential will be the information that you glean about him. Now, this potential client and patient reports that he has a medical degree and a law degree. He has never been in therapy before. He wants the very best, and he's gotten your name from a couple of sources, but he expresses that he does not know exactly what he should be looking for in a psychotherapist. He wishes to deal with career and family issues. His manner is gruff and distant. Okay, I want you now, if you will, to pair up with one other person and answer the following questions. What do you feel? What does this potential client or patient approach tell you about him? How do you respond to his questions, given who you are? Given who you are, because I want you to speak to you're being a male or you're being a woman. I want you to respond to I want you to talk about what you need to know to consider taking him on as a client or a patient. So take about 5 minutes, if you will, to do that. Okay, let's stop. And let's go ahead and just kind of throw out some answers to these questions. And remember that there is no right answer. The dilemma in here is one that you get to define how it's a dilemma, if it's a dilemma, and how it's a dilemma for you, and how you feel you would respond. So first of all, how do you feel with someone like this? What does that do? What does that evoke in you?
Well, I told my partner that I kind of like rough men who are, clearly kind of anxious about the process, and I often find that just being very casual and explaining that it will take a few visits, 2 or 3 visits before we can, see if we click with each other, if you're comfortable in this setting, if you're, wanting to continue, if we can identify the goals.
So for you, you enjoy the challenge of someone like this.
I'm sorry?
You enjoy the challenge of someone like this.
And
okay.
I've had good experiences.
And you're good at it. Okay, so that's good. Other reactions?
I probably feel a little intimidated at first, and then I quickly about the third question start to feel irritated.
Intimidated and then irritated. Yeah.
Annoyed with the questions.
Mm-hmm. Okay.
Not wanting to spend a lot of time on the phone.
Right.
With somebody who may decide not to come in.
Right. For somebody who may decide not to come in, you don't want to you don't feel like spending the time. Yeah.
I routinely don't spend a lot of time with potential patients on the phone.
So you don't spend time with patients on the phone. I'm going to be repeating your comments because we're taping. They've asked me to repeat comments. Yeah. Okay. Other reactions? Yes.
Well, actually, something like this happened to me recently with a client. And so, I mean, to me, it's like part like defensiveness. I feel, why is he wanting
In you or him?
No, in me.
Yeah. Yeah.
Why is he asking about my credentials and if I'm a good therapist and things like that.
Mm-hmm.
But also a little bit of empathy as well, because it seems like it's coming from a place of, him wanting to get help that's going to be effective for him.
Yeah. So some defensiveness, but also some empathy on the other hand. Yeah. Okay. Yes, back here.
I also would feel pretty defensive, and reading those questions, because I have had clients do that in the past, that they've asked those things, I do tend to start to feel defensive and need to prove myself, and we had discussed that. But something I find myself doing, and that I want to do as I was listening to him, is to level the playing field, kind of take the hierarchy down and just kind of get it back to where just 2 guys talking on the phone. That's really all this is. Maybe throw in some humor or something. That's kind of what my my impulse is whenever I read that.
Okay, so you'd feel some defensiveness as well, but then you would try to diffuse it by trying to connect and kind of cut through the credentials, cut through the style that he's using, and try to maybe even use humor. Okay, good. Other thoughts, reactions to feelings? And what do you make of him? What are you hearing about him? What is it that he's doing that you're hearing about? What does it say about him?
I'm trying to control the situation.
He's trying to control the situation.
He's probably anxious and uncertain about how to proceed and wants to make a good choice.
Anxious, uncertain about how to proceed, wants to make a good choice. He's never been to therapy before. He's an older man. This is a new experience. There's stuff going on in his life that leaves him feeling vulnerable and in need of taking this step, although it's probably something he would never do ordinarily. Anything else?
Big focus on career. Your career is the therapist, and I think that also reflects back on his career and all his degrees might be causing some of his career family issues.
Okay, so focusing on your career is a big issue for him. Okay.
It seems as if like his career and his focus on degrees and careers and things like that are almost his way of coming into a situation with some control, kind of throwing up a smoke screen about why he's really here. And let's focus on some things that kind of establish us and where we stand in relation to one another. So I kind of start to wonder, well, what's past all that? Why are you calling me in the first place? You don't even know about my credentials, and I don't even know your wife. Really
Right, right. So what is, you start to, it gives you information that there's more to know, a lot more to get to know about this person. Okay? Anything else that you come up with or think of in this case? One of the things, and I did see someone like this, one of the things that happens for a person like me, a woman of color, is that sometimes they see me as a woman of color first and a professional second, or sometimes third or fourth. And so my automatic reaction to deal with the anxiety that this particular client evoked in me on the phone was to pathologize him as a paranoid and obsessive compulsive. That was sort of my defensive reaction. The healthier alternative was to compassionately acknowledge that this was his first time to consider psychotherapy, that it was very difficult for him to be vulnerable and ask for help. And so I was able to conceptualize what I experienced as his interrogation, because it was rare for somebody to ask that many questions, as simply strategies, as some of you have already said, to feel safer in embarking on a vulnerable endeavor, and maybe particularly with a person of color. He kept saying things like, well, I hear you're good, like he was not quite sure he could believe that. These strategies eventually can be explored in the psychotherapeutic process, and their relative merits and consequences can help the client feel more, make more informed choices about his behaviors in terms of how he comes across, but that's later down the road. His privilege, I'll talk about privilege in a minute, in assuming that he should have the very best, you notice that, is sort of congruent with the fact that is incongruent with the fact that I was a woman of color, probably in his mind. If he has those subconscious stereotypes. I'm aware that as a Latina psychotherapist, many of my clients of color choose to come and see me because of my ethnic identity. Other people of color with internalized racism might choose to avoid seeing someone like me. I'm also aware that many, if not most, of my white clients have to go through some kind of process of cognitive dissonance to assume my competency if they grew up in this country. Because growing up in this country means that a person of color is not necessarily competent. Those are the negative stereotypes. And so they've either had other experiences or they have to go through a process of somehow seeing me as an exception. I mean, think about how many of you, the professionals that you go to, your attorneys, your dentists, your doctors, your, whatevers, are people of color. And if you do you think twice? Okay, do you think twice? And if you do, that would simply be